everybody. This is Dr. Tyler Evans from NUCCA Chiropractic coming at you live with the research moment. It's been a little bit since I've done one of these, and today, where's my paper at? Just shoved it in there. Does somewhere. Anyways, today I am reviewing a paper titled Effect of Atlas Vertebra Realignment in Subjects with Migraine, a pilot study, an observational pilot study that was done in 2015 by a very prestigious group of people, the NUCCA group in our upper cervical world. Very similar type of upper cervical correction to what we do here in this office. And this is a great study. Lots of very deep scientific study done in this paper. And really what it comes down to is they took 18 patients from neurologists that had chronic, severe, frequent migraines, very, very intense, frequent migraines. And 18 of them, they were diagnosed, right? But 11 of them were actually included into the observational study. And after 8 weeks of care, what they found was that of those 11 people, their migraines reduced in frequency, and they had better quality of life, and they had less frequency, meaning less migraines. Severity was less, and their VAS, so their scale of pain, was less overall. And so it just goes to show that getting your upper neck corrected can help drastically reduce some of these severe neurological conditions that people suffer from all the time. And there's medications for, but there's so many other good solutions out there as well. And if you are in an area, you should go get in an area that has an upper cervical chiropractor close to you. You should definitely go get your neck checked if you suffer from frequent migraines. And the reason for that is manyfold. The guy next to me, right there in the picture, that's one reason. And what happens is if your eyes come out of level because your head tilts to one side, the top neck bone tilts and out of place, it throws the whole spine out of balance. And so what we do in the upper cervical world is we get that upper neck balanced, it balances the eyes, and then the rest of the spine levels underneath. And what that does is this top neck bone right here, it's the most freely movable bone in the spine. But the problem is all the contents that go in and out of the skull have to go through this hole. So if that bone is misaligned like this in an accident or an injury, whether that be a car accident, sitting at the desk for too long, or even birth trauma, it happens at birth, then you can have these symptoms that persist long after. And getting that upper neck corrected can relieve the pressure here that allows for better fluid flow between the brain that sits here and the rest of the body below. The multiple different types of fluid that we talk about are cerebrospinal fluid, arterial blood flow to the brain, venous blood flow away from the brain. That skull is literally like a pressure cooker. The fluid that comes in has got to get out immediately. Otherwise, we get things like pressure, headaches, and migraines. And some people suffer from these things like every day. And in bouts where they have to literally be in a room for days at a time, a dark room. And that's no way to live. But upper cervical chiropractic care is one solution, one way to help that fluid get out of the brain and balance back and forth better, as well as to free up the nerve flow so that the brain can heal and the body can heal as well. So it's no twisting or popping. It's a very gentle, precise correction to C1 and C2, and it's a very conservative treatment versus some of these medications have severe side effects like more headaches or long-term brain issues, memory loss, fatigue, things like that come about because people are taking these medications to try to, get some relief, but there's other solutions. So looking up an upper cervical chiropractor in your area may be a very beneficial thing just to get your upper neck checked. If you've had an accident or injury before and your neck has been affected and you've developed migraines at some point, sometimes it happens a year later, sometimes it happens 5 years later, sometimes it happens 10 years later. But it's a pretty basic pattern we see in our office. I mean, sometimes it starts usually for the migraineurs, which are what it's called when you have severe migraines for most of your life. Those usually start very early on. So sometime in the 5 to 10 year to 15-year range, around when puberty starts, and then on through. And part of that may have to do with hormones, and that's why they don't entirely go away for everybody. But we have many patients in our office that get great results with these migraine symptoms. Not saying they go away entirely, but if it can help you get your life back so you don't have to live in a dark box, that's a huge thing. So, if there's an upper cervical chiropractor near you, it could greatly improve your life to go get checked by an upper cervical chiropractor. Get your head on straight to make your body work better, is what I always say. And again, it's Tyler Evans from Arete Chiropractic in Portsmouth, New Hampshire. If you have questions, we're here to answer. Our phone number is 603-380-9184. That's 603-380-9184. And I wish you guys well, and let us know if you have questions. Take care.